Hello. Today, I'd like to talk about something that many people struggle with, and that is symptoms of depression. If you've ever had a period of time when you felt persistently sad, hopeless, or disconnected, then you're not alone. Depression affects millions of people, and it can take a toll on both your physical and mental well-being. But the good news is that there is help available. One of the most effective treatments for these symptoms of depression is Cognitive Behavioural Therapy, or CBT. In this video, I'll explain some common symptoms of depression and how CBT can help you feel better. Depression isn't just about feeling down for a few days. It's a persistent condition that can affect every aspect of your life. People with depression often experience a range of symptoms that can be emotional, physical, and behavioral. And some of the most common symptoms include a constant feeling of sadness or emptiness, a loss of interest in activities that you once enjoyed, difficulty concentrating or making decisions, changes in sleep patterns, either sleeping too much or too little, fatigue or lack of energy, even after a long rest, feelings of worthlessness or guilt, and sometimes even thoughts of death or suicide. If you've been experiencing these symptoms for a prolonged period, it's important to recognize that these symptoms of depression are not something that you have to or should have to just snap out of on your own. It's a real condition. There is support available to help you navigate through it. One of the most effective ways to treat depression is through Cognitive Behavioural Therapy. CBT is based on the understanding that our thoughts, feelings, and behaviors are interconnected with each other. When we're feeling low or depressed, we often have negative, distorted thoughts about ourselves, our world, and the future. These thoughts can lead to feelings of sadness, hopelessness, and guilt, which then can in turn lead to withdrawing from activities, isolating ourselves, or avoiding the things that could actually help us feel better. For example, someone with depression might think, I'm worthless, or nothing ever goes right for me. These thoughts can make a person feel overwhelmed or trapped, and they might stop trying to engage in things that could improve their mood, like spending time with loved ones, exercising, or even getting out of bed. This is where CBT comes in. One of the key goals of CBT is to help individuals identify these negative, unhelpful thoughts, challenge their validity, and replace them with more realistic and balanced thoughts. For instance, if you're struggling with the thought, I'm worthless, CBT could help guide you to explore evidence around what might contradict that thought. Maybe you've made mistakes, or maybe you've also had past accomplishments, or people around you have shown you care. Over time, this can shift thinking and can help reduce feelings of hopelessness and empower you to take more positive actions in your life. Often, depressive symptoms lead to a cycle of distancing ourselves from important people in our lives, and we might withdraw from other activities, doing less of the things that we know are good for us, which only tends to worsen the feelings of sadness. Through CBT, we can work together to set small, achievable goals that are meaningful for you. Maybe it's just getting out of bed at a specific time, or engaging in a short walk, or reconnecting with a friend. These small actions can break the cycle of avoidance and self-isolation, and it can help you regain a sense of control. It's important to remember that CBT isn't a quick fix. It takes time and practice, but the goal is to give you skills and strategies to manage your depressive symptoms and feel more in control of your thoughts and emotions. Over time, these tools can help you build a stronger, healthier mindset. If you're experiencing symptoms of depression, please know that help is available, and CBT might be the right path for you. Here at Ontario Structured Psychotherapy Central North, we offer government-funded, structured CBT in both self-guided and therapist-led formats. Make a self-referral on our website at www.therapyontario.ca today.